Hello, my name is Cynthia Deveaux-Moona. I'm going to be doing my physical assessment on Kayla Wilkins and for NR509.
I give Cynthia permission to do my physical assessment.
Okay, so basically I'm going to introduce myself to Kayla. My name is Cynthia. I'm going to do your physical assessment and I'm going to examine Kayla's face. And as I examine her face, I see that her face is midline and there are no lesions on her face, and it's nice and symmetrical. Next, I'm going to begin by palpating her lymph nodes. I'm going to start with her periocular lymph nodes, which is in the front of her ears, and we're going to move to the back of her ears and palpate her post-auricular lymph nodes. And we're going to go to the back of the head, and we're going to palpate her occipital lymph nodes. And then we're going to come down and palpate her tonsillar lymph nodes. And then we're going to come up under the chin and palpate her submandibular lymph nodes and her submental lymph nodes. And then we're going to palpate the anterior cervical lymph nodes. Okay. All right. And then we're going to palpate her posterior cervical lymph nodes. And then we're going to come down right above the clavicle and palpate her supraclavicular lymph nodes. Okay, and I feel everything is symmetrical, and I feel no lumps or masses, and they're equal bilaterally. Next, we're going to test Kayla's cranial nerve number 5, which is the trigeminal nerve. I'm going to palpate the masseter muscle, and I'm going to have Kayla to clench her jaws, and her muscles are nice and strong. Next, we're going to test the trigeminal nerve again, which has a sensory component. I'm going to have Kayla to close her eyes for me and let me know where she feels my touch.
My forehead, my chin, my left cheek, my right cheek, my nose.
Okay, and that's intact. Next, we're going to test cranial nerve number 7, which is the facial. And we're going to have Kayla to make some facial expressions to test her muscles in her face. So we're going to have Kayla to smile for me. Can you frown for me? Can you lift your eyebrows and close your eyes, clench them really tight? And if you can puff out your cheeks and pucker your lips. And her facial muscles are intact. Next, we're going to look at Kayla's ears, and I see that her ears are nice and symmetrical. If you can hold your head up for me. And I see, I don't see any lesions or anything on her ears. And we're going to inspect and look inside her ears. I'm going to take my otoscope. And I'm going to pull up her pinna up and back. I'm going to examine her ear. And I see that her auditory canal is nice and clear, no cerumen, no redness, and her tympanic membrane is pearly gray, and no effusion. We're going to come to the other ear. I'm going to pull the ear up and back. And again, I see that her external auditory canal is nice and clear, no cerumen, no redness, and her tympanic membrane is pearly gray. Next, I'm going to palpate her pinna, and I feel no nodules in her tragus, no tenderness there. Okay. Next, I'm going to examine Kayla's eyes. I'm going to check her conjunctiva. And I look and pull her eyes down. I see that they're nice, moist and pink, and her sclera is white. Now we're going to test cranial nerve number 2. I'm going to get my eye chart, and that's her central vision. And we're going to check her eyes chart. I'm going to step 6 feet away, and we're going to see if she can read the lowest line. So Kayla, if you can cover your right eye for me. And read the lowest line.
L, F, T, P, H.
Okay, if you can cover the other eye for me. And read the lowest line.
LFTPH.
Okay, if you can, both the eyes, please.
LFTPH.
And her vision is okay. We're going to check for her optic nerve, cranial nerve number 2 again, and I'm going to have Kayla to stand up. And I'm going to see if she can see my hands as I come. I'm going to check her peripheral vision. So, do you see my hands?
No.
Tell me when you do.
Yes.
Okay, and above, do you see my hands?
No.
Tell me when you do.
Yes.
And below, can you see my hands?
No.
Tell me when you do.
Yes.
Okay, and her peripheral vision is intact. You can have a seat. Next, we're going to test her cranial nerve number 3, 4, and 6, which is the ocular motor, her trochlear, as well as her abducens. And we're going to check for EOMs, for extraocular movements. And I'm going to do this by drawing an imaginary H. And if you can look straight ahead and follow my finger. Okay, and that's intact. Next, we're going to inspect Kayla's mouth. I'm going to go back because we need to also check for reaction for Kayla. I'm going to go back to Kayla's eyes again, optic nerve number 2. We're going to check for her perla for reaction to light. Normally, I would have a ophthalmoscope, but as you can see, it broke, and so I had to get a pin light. So we're going to use a pin light to inspect her pupils to see if they're reactive to light. I'm going to come from the side with my light. Okay, and I see that it's reactive to light, and her pupil is reactive to light, and it was like 3 millimeters. Okay. Okay, and pupil again reactive to light, and 2 to 3 millimeters. Okay. Next, we're going to take my same pin light, and we're going to inspect Kayla's mouth. I'm going to look at her lips and make sure that there's no lesions or any sores or anything like that. They're nice and pink and moist. If you can open your mouth for me, please. Open wide. Ah. Okay. And I'm going to check for any decay. And I see no decay. And I'm going to look in her soft and hard palates. And it's nice, pink, and moist. And if you can, I'm going to inspect her tongue. It's nice, and if you can stick out your tongue for me. Okay, the tongue is nice, symmetrical, no lesions. Lift up your tongue. And I see no lesions. Everything is nice, moist, and pink. And in the roof of bottom of her mouth is nice and pink and moist. Okay. Next, we're going to normally we don't check the gag reflex, which is the cranial nerve number 9. But I am going to ask Kayla to open her mouth and say ah, so we can check cranial nerve number 10, which is the the vagus nerve. You say ah. And the uvula rises and falls normally. We're also going to check cranial nerve number 12, which is the hypoglossal. If you can stick out your tongue, please, and move it from side to side, and that is intact. Next, we're going to palpate her TMJ. So I'm going to have to palpate the TMJ here. If you can open and close your mouth. And I feel no subluxations, no crepitus, and no pain or tenderness. That's intact. Next, we're going to inspect Kayla's neck. And I'm looking at her neck, and I see that her neck is symmetrical. I see no lesions or no deviations. I'm going to look at her trachea. Her trachea seems to be midline. Okay. And I see that there's no deviation of her trachea. And I'm going to palpate her thyroid gland. Okay, and I can palpate her thyroid gland right there. And I'm going to have Kayla to swallow for me. You can swallow. I'm going to swallow for me. Perfect. Swallow again. Okay. I see that the thyroid gland rises and falls, and I can feel it there. Okay. Now I'm going to palpate Kayla's carotid arteries. Okay, we're going to start over here. Okay, and her pulses are 2+, they're bounding. And we're going to palpate on this side. Okay, pulses are present and bounding. Next, we're going to auscultate Kayla's carotid arteries, and we're going to listen for any bruits. And I'm going to have Kayla take a deep breath, so that her breath sounds don't distort interfere if there's brewery present. Okay? Deep breath in. Okay, out. Very good. Deep breath in. And out. Very good. And there's no brewery. Next, we're going to auscultate. I'm going to auscultate Kayla's heart sounds in the 5 spaces here. We're going to start with the aortic, and we're going to. It's going to be listen at the right of the substernal border around the second intercostal space. Okay. Then we're going to check the pulmonic valve, which is to the left of the substernal border in the second intercostal space. Then we're going to come to the third intercostal space for the McBurney's point. Present. Then we're going to come to the tricuspid, which is the 4th intercostal space. Okay. And then we're going to check the mitral, which is at the mid clavicular line, 5th intercostal space. And that is the mitral valve. Okay. Okay, great. All right, next we're going to auscultate Kayla's lung sounds. I'm going to examine her chest, of course, visualize the chest. And I see that the chest is midline. She's not using any accessory muscles for breathing, and everything is symmetrical. So I'm going to listen to her lung sounds. Okay, deep breath in. Okay. All right. Okay. Now I'm going to have Kayla to stand up, and we're going to turn her around. We're going to listen to her lung sounds posteriorly. Okay, I'm going to go right up on the scapula area. Start here, deep breath in. Okay. Very good. We want to make sure we get to the right middle lobe. Okay. And again. Okay, very good. Have a seat. Next, we're going to examine Kayla's extremities. We're going to have Kayla to stick her hands out for me. And we're going to examine her hands. I'm going to look for any nodules in her joints, and I see no nodules in her joints. And I'm going to check her capillary refill, and I do this by pressing down to get the white. And as I press down and I lift up, wait till the pink returns, and her capillary refill is in 3 seconds. And we're going to do this to the other hand. We're going to press our fingers until we see white, and then lift up, and the pink returns within 3 seconds. Next, we're going to check for Kayla's pulses. Okay, the pulses are equal bilaterally, and they're bounding 2+. Next, we're going to check for hand strengths. If you can squeeze my hands tight for me. Very good. Okay, and our hand strengths are 5 out of 5. Okay, next we're going to check her her range of motion of her elbow. So we're going to do extension and flexion, and that works well. Then we're going to check her range of motion of her. We're going to check her strengths of her arms. Okay, if you can bring your arms up for me, and you can feel. Okay, when I pull, the resistance is there, and push away. Perfect. Her strength is 5 out of 5. Next, we're going to check her range of motion of her shoulder. Okay, we're going to do flexion, extension, and we're going to do internal rotation external rotation, and we're going to do adduction, abduction. Okay.
Let's get him.
Next we're going to do her deep tendon. We're going to check her deep tendon reflexes, and we're going to do this by. We're going to do her deep tendon reflexes, and the deep tendon reflexes. We're going to have her elbow. We're going to rest it here, and we're going to have her to rest her hand up, just relax it, and we're going to check her reflexes. Okay, and that is present. We're going to check her and that I use the pointy end of my mallet. Now we're going to check her reflexes here. Okay, and that's present. And we're going to go down and check her Achilles. Okay, present. Okay, next we're going to have Kayla to lie down, and we're going to examine her abdomen, and we're going to, I see that her abdomen is symmetrical, no lesions, no lumps, no masses, and we're going to, I'm going to auscultate her bowel sounds. If I can close it in my mouth. Okay, and I'm going to listen here. And all four quads. And all her bowel sounds are present. Next, we're going to, I'm going to percuss in all four quads to check for any tympany or flatness. And I feel no tympany, no flatness, and no dullness. Okay, next we're going to palpate in all four quads. And I feel no masses, anything there. Next, we're going to listen for her arteries and listen for any bruits. And her aorta, we're going to listen to the aorta, which would be under the substernal notch. Okay, and we're going to listen to her right renal artery, which will be to the left, this is her left renal artery, which will be to the left and above the umbilicus. And her right renal artery, which would be to the right and the above the umbilicus. And then we're going to check her iliac artery to the left of the umbilicus.
You gotta talk louder.
To the left and below the umbilicus, and to the left and the right and below the umbilicus for her iliac artery. Next, we're going to, there are no bruits present, and we're going to palpate her liver, and it's going to go to the, we're going to go to the subclavicular border here, and I still know, her costovertebral line. It's okay, go ahead. The costovertebral line, and I feel I should be able to palpate the lip of her liver. If you're going to take a deep breath in for me. Okay, go pushing in under the costovertebral line. And if you can roll to the side, I'm going to palpate your spleen. Okay, perfect. And we're going to go again to the costovertebral line. If you can take a deep breath in. And I'm not able to palpate the spleen. Okay. Great. And now I'm going to examine her legs, her lower extremities. I see no edema and no lesions and no wounds or anything in her legs. And we're going to do the check the range of motion of her knee. We're going to flex her knee. I'm sorry. We're gonna extend her knee. I'm sorry, this is flex. Flex her knee, and then we're going to extend it. All right. Next, we're going to check her hips. We're going to check her hips, and then we're going to range of motion of the hips. We're going to flexion and extension, abduction, adduction. We're going to bend her knee, and we're going to do external rotation, internal rotation. And she has good range of motion in her hip. Next, we're going to check the range of motion of her ankle. We're going to do dorsiflexion, plantarflexion, and rotation. And she has good range of motion. Next, we're going to check her strength. We're going to have her to push down on my feet for me. Plantarflex, and then we're going to have her to dorsiflex. Pull against my hands. Okay, don't let me pull down. And she has good, her strength is 5 out of 5. Okay. We're also going to check her pulses, Rosalis Peters pulse. Okay, and that is present. Okay, now we're going to have Kayla to sit up. And we're going to examine her legs. I'm sorry, we're going to examine her spine. If you can stand up for me. So I'm going to palpate her spine. And I'm going to feel for any deformities or any lesions. And I don't feel anything there. And we're going to check the range of motion of her spine. So if you can, if you can lean forward. Lean forward. Okay, and then extend backwards. Excellent. Okay, and we're going to have Taylor to rotate from side to side, and she has good range of motion. I'm going to also I'm going to have Kayla to lay back down one more time, and then because I did not check the lumbar, I want to make sure I do that. Make sure she has a negative lumbar sign. So I'm going to put my hand, go straight down with my hand, and see if she has any pain upon rebound. You have any pain?
No. No. No.
Okay, you can go ahead and stand back up. Thank you very much. Now we're going to check for a Romberg. We're going to have Kayla to stand with her eyes closed. And I'm going to check for any swaying or any movement. And I don't see any. Okay, now I'm going to have Kayla to walk for me. And come back. And she has good, her gait is normal. And that concludes my physical assessment. Thank you.